Okay, we are live. Welcome to the CWK show, Conversations with Katinda Live, where we talk about this thing we call life. Now, in today's show, I'm so delighted and honored to have the fabulous Dr. Francis Aqua. Francis is a mental health nurse who will give us some tools, some strategies on how to protect our mental and emotional health during COVID-19 lockdown and beyond. Welcome to the show, Francis.
Thank you, Katinda. Nice
It,
to be with you.
nice to talk to you tonight. Now, Francis, in our conversation today, we will be sharing, educating, and informing the viewers the importance of protecting their mental health and emotional well-being. So, Francis, what inspires you?
Wow. A lot of things inspires me. Um, what's tomorrow? Who knows what tomorrow is? Today, tomorrow, we don't know. But the important thing is being alive, being able to wake up and see. In Melbourne, it's the four seasons that happens in one day. They are the inspiration. The changes in our weather. I wake up and I see my tree in front of my garden, which has now lost its leaves, and come back in a few months' time, and you'll be surprised to see the same tree full of leaves.
Right,
So it's
right.
about what we do every day.
Wow.
The,
Now, Francis, so we know that fear, worry, and stress are normal responses to perceived or real threats. And at times, like now, we are faced with the unknown. So sort of like it's a normal thing and understandable that people are experiencing fear in the context of the COVID-19 pandemic. And added to that fear of contracting the virus in the pandemic, such as COVID-19, there are significant changes to our daily lives, such as, we're restricted to where we can go, where we can be. Obviously, there's issues about we can't go to work because they're trying to protect everybody. There's a lot of unemployment at the moment, homeschooling of children, and lack of physical contact with other family members, friends, or colleagues. Now, how can we look after our mental health as well as our emotional well-being in this kind of situation?
well, it's absolutely important. Anxiety or being anxious is actually a normal thing. It's common. In fact, sometimes if we don't feel anxious about something, then we're actually not right. But it's important that we put it in perspective. So let's take some scenarios and let's work through. Of course, most people, I'm one of the few ones who is still working, still going up on the road, still seeing clients. But the first thing is that we must develop a routine. We must have a focus. We must then put it into practice. It's no good saying things or drawing up a plan and not following through. Like we say, if you build a house on a soil, if the wind comes and blows it, it will fall down. If you build a house on a rock, of course, it will stand the wind. So let's put a routine in. Let's go to bed at the same time as we normally go to bed. Wake up at the same time in the morning. Take up the routine of having a shower. Don't work in your night clothes. Of course, if you work in your night clothes, then you're going to feel sleepy halfway through your day. You must then go to your bed. So dress up, have a routine, have your breakfast, have morning tea, not in front of your screen or your computer.
Right.
Have proper lunch, have afternoon tea, have dinner. Close your computer at 5 o'clock when you finish work. I would just say one thing, and don't laugh because it's serious.
What's that?
My my telephone actually lives in the bathroom after 9 o'clock at night.
Right.
My telephone lives in the bathroom because I don't want to look at the screen anymore. But let's put it in perspective of people. In fact, some of my clients who are actually working full time from home are the ones who are actually experiencing some difficulties.
Right.
Why? Their concentration is not full. Their productivity have dropped significantly. They seems to be working all the time and they are not achieving anything. So it's important to have those important breaks. Now, this is a medical issue, but I will bring it in anyway.
Sure.
We are all short of vitamin D
Oh,
because
yes.
because we spending a lot of our time indoors. Now, I've talked about our fantastic Melbourne weather, 4 seasons in one day. What I'm going to ask you to do is, as soon as you see the sunshine, run outside and grab some free sunshine. That will boost your vitamin D. Now, what does vitamin D do for you? It helps with your bones. It helps with your circulation. It helps with your heartbeat. It prevents diabetes, your pancreas, your blood circulation, your bone density. This is very, very simple, but we're not thinking about it. So let's think about those small, small, but very, very important things that will help us reduce the level of anxiety. If I may go on, Kitinda,
Sure, go for it.
talked about talk about the level of the news we are listening to. Now, I don't know what the stats is today. Now, people are watching the news 24/7.
Right.
It's not helping our brain. It's not reducing our anxieties. Now, why don't you go for a small walk around the block? Somebody will be telling me, when did I last go for a walk? But I run in and out of the car all the time. That's my excuse. Go for a walk. Now, just not going just for a walk, observing. Like I've mentioned, the tree outside my house. Do you know the color of your fence? Do you know the color of your neighbor's fence?
Right,
Do you
right.
know the strangest car in the driveway or around the corner from your house? So it's about actually observing, taking in the beauty around your neighborhood that you are missing.
Now, Francis, we've got a question from a viewer who sent it earlier. Her name is Kathy, and she goes, "How do I know if I have anxiety about the coronavirus disease?"
Obviously, the anxiety is when something is beyond what you personally, not me, not Ketinda, not your neighbor, as we've been talking about, perceive as abnormal. So, increased heart rate, increased worry, increased checking, feeling uncomfortable. Those are the little but subtle symptoms that start. All of a sudden, you're not sleeping, you're ruminating, you're thinking about the same thing over and over again. You are checking. I used to have a client who was obsessed. I've never heard of Twitter before then. Of course, now we all know Twitter.
Yeah.
But a number of years ago, this lady was addicted to Twitter, and she couldn't. She would be sitting right in front of me, and then she would pick up her phone and tweet. And I said, "What was that?" "Oh, sorry, I just sent another one." Until when she comes into my office, the first thing we do is she gives me a phone and we talk. So we have to start changing some of those things. When did you actually last have a conversation with somebody? When did you actually talk to someone without using the phone? I know we're doing social distancing, But for some of you who can interact with other people, when did you actually watch a movie together and actually talked about a movie? Have you played a board game recently? I'm not sure whether who this audience are, Ketinda,
Right.
but if I mention the word Ludo, does people even know what a Ludo is?
Ludo is a
Does
game we used to play in the day.
You said used to, you
Used
see?
to play, yes.
Used to play. When did you last play Monopoly? When
Oh
did you
dear.
last when did you last play Scrabble with other people? When did the children do the children even know what a Scrabble is? So it's about starting to re-engage with people. Some of the things that I've got my clients doing is bringing back their old hobbies. I've got somebody playing the ukulele. I've got somebody playing the guitar, somebody playing the keyboard. Now, I missed a video conference on Sunday because I was cooking. I experiment on fish in floured beer and flour.
Right, right.
Now, I made it myself, and I've just had the last bit, Ketinda, this evening. You asked me if I've eaten already. That was what I had for dinner.
Yeah.
So, experimenting on cooking, experimenting. I've got people actually cooking different type of food, but not just cooking different type of food. What is the story behind it? So you're cooking curry. Who is famous for curry? India. You cooking spaghetti bolognese. Who is famous? So you start researching. When did you last make? Do you know what a moussaka is?
Well,
Which country?
are you talking more about people just instead of just doing things? Because I believe what or most people do, we just do things. We never really sit and feel and experience and enjoy what it is we are doing or eating or things like that. So what you're bringing up is very important because I know a lot about food because I've been to over 45 countries. But there's a lot of people who just eat the food, like you said. You know, what's moussaka? What country is it from? I mean, I know it's from Greece. Or it's Greek people eat
Exactly.
moussaka,
You got
yeah.
it right. You got it
Um,
right.
but there's a lot of people who just eat all these foods because it's there. But people are so busy, and this is why we've taken so much for granted. And I believe maybe now is a good time to slow down a little bit, and especially people who have contact with each other, like families who are in the same space. Because what you're talking about is basically for families, people who are at home together. Activities to keep them excited, to keep them busy, to keep them inspired. I guess I should say, and food. What better way to do it? Everybody's
Ex-
always eating, and food is what brings people together. And like you said, what's the story behind it?
Exactly. So that's what you need to start thinking about doing. How do we share? How do we engage the people within our family with the food? What to look forward to? Okay, Australia, Friday nights, what do we love? Fish and chips. Of course, foodie is back, but we're not going to just watch the footy. We're going to sit there and talk about it. Why are there no people on the field, etc., etc.? So it's about stopping our brain and stopping our sight from the screen and doing other things. Reducing the anxiety is actually by taking action, by diverting, this is what we call diversional therapy,
Right.
diverting our attention from the constant ongoing things about this virus. We need to take some deep breath. I don't want to use the terminologies like mindfulness or art therapy, but
Yeah.
these are the things that we can practically do to change how we are feeling.
So now, Francis, I've got another question from Vicky, and she asks, "What can I do right now to manage my COVID-19 anxiety?"
So the first thing we have to listen to is doing the right thing. Now, my clothes, actually, I have masks to match my clothes. I got my mask 4 months, 5 months ago, and I have in my car my mask, my gloves, my sanitizers. In fact, I have spare ones. The other day, I went to a shop, and there were people coming into the shop not wearing the mask. I turned myself into the COVID police and asked them to leave. And I told the shopkeeper not to allow people into the shop without a mask.
Right.
We must all take those responsibilities. Of course, sometimes you're going to be get. In fact, we went to Victoria Market about a month ago or so when the lockdown was lifted.
Yes.
And my wife pointed out to someone, you need to be 1 point, and the person got angry and left. Guess what? Who was the loser? She was the loser because she didn't buy what she wanted to buy. We must actually continually educating people because there are a lot of ignorant people there who think we can't. At the moment, we don't even know even how this virus is being transmitted. The honest truth, people, I'll take you to my area, which is Epping. There was a nursing home here. Last week, we had about 2. By the weekend, it was 24.
24
And
what?
24 positives within the nursing home.
Okay.
And yesterday, it was 77 in that one nursing home or aged care facility. Now, how did that go out very, very quickly? So the question is this thing even being transmitted through the heating system in the place? Nobody is talking about that. We may be calling it human to human transmission, but how can this be so rapid within a week?
That is very, very scary, I believe. Oh my gosh. Now, there's another thing, Francis, here. Tom's asked the question, should I talk to a therapist about COVID-19 anxiety?
Of course, I'll use the 2 key things, grief and depression. Now, grief and depression exhibits the same number of symptoms. So, can't sleep, loss of appetite, feeling irritable, feeling diarrhea, constipation, unable to, feeling lethargic, tired. When you experience a grief or a loss. Now, those are all the same symptoms as depression. The only difference is that depression stays for up to 2 weeks. Then we clinically diagnose somebody having clinical depression. Anxiety is very, very similar. Unfortunately, when the same thoughts are not going away, the same symptoms of feeling uneasy, feeling that your heart rate is increased, feeling agitated, feeling irritable, fear of something unknown is going to happen, fear of actually dying, then you need to seek help. Our first point of call is our local GP. And as you know, GPs can do assessment over the phone, teleconference. And in order to get through the Medicare system, then a GP can refer you to a therapist. So it could be a psychologist, a mental health nurse, or a social worker. I guess I will prefer you seeing a certified professional than going and seeing somebody else who may be calling themselves a therapist or a counselor. So your GP can also do a physical health check to rule out any other symptoms. So it's best if you see your GP first for the appropriate mental health assistance.
Right. So I have here also um, someone called Carol. She's asked the question, how can I worry less about missing work if I'm quarantined or my kids' school is cancelled and I need to stay home with them?
Okay, so as you are aware, I mean, we are lucky in Australia. We the government has put in a series of things, job keeper, um, um, job seeker payments. So the first thing is if you are working or you are employed and in that situation is to discuss it with your employer to see what is available. The news is if you are in Victoria and you have been tested, waiting for results, and you've actually used all your existing leave, which is it's been the standard thing forever. You know, if you have to go on work cover, you have to use your existing leave, then you are entitled to some payment. So the best thing is to check it out, what you are entitled to. If you are not sure, discuss it with your employer, and they will point you in the right direction.
Right, right. Now I have.
With regards to kids, yes, you were gonna.
No, go ahead.
Is that a second?
No, go
Yeah,
ahead.
with regards to kids, it's about again developing routine. If they have to study from home, pace it for them. Obviously, you are not a teacher. They have a level of homework they have to do. They need to play. Like I said earlier on, they need some sunshine. Take them out, take them for a walk. Obviously, if you have a bigger garden, then every time they have a break, take them outside. Otherwise, if you have a small place, take them for a walk. In Melbourne, dress appropriately as well.
Sure.
Kids are not under 12 are not required to wear a mask. Some of the playgrounds are closed, but let them run around the open park. Let them observe. Give them some assignment to do. Hey, let's count how many red cars we see on this walk. Count how many white cars are there. Or let's check which car starts with a I as a number. Something to stimulate their brain, but take their attention off the rest of having the television on constantly 24 hours doesn't do their brain any good.
Or playing games as well. Most
Yes,
children play games and
yes,
video games.
absolutely. One of my family I've introduced to them recently is to have a radio in their bedroom to play music instead of everything on the computer. After 8 o'clock, no more screen, no more viewing a screen in the house.
No technology.
Yes.
Yep.
If they have to listen to something, then they listen to music in the background. So let's start changing. A lot of us existed. We survived. We didn't even know what a phone was. Until I went to England, there was only one telephone between the two houses.
That's right.
When somebody rings, then you have to, or even when I rang home, I have to ring, wait, and said, I need to talk to my mom. Can you check if my mom is home? And then I say, okay, my coins will run out, so I'll ring back in 5 minutes.
Right.
And then you ring back and you speak to your mother. So we've existed before these gadgets. There used to be my uncle. We have to walk. I won't exaggerate, but at least
a long time.
5 kilometers or 6, maybe, a good half an hour to my auntie's house for us to sit down and watch television. One television. We watch a soccer game, and then we watch Lassie on television. So we've existed before all these gadgets. and we can't exist without them. So let's throw some of these things away and let's re-educate our children, and they will have stories to tell, like I'm telling now.
Very true, very true. Now we've got a question from Tina, and she goes, how do I handle feeling lonely or anxious if I'm isolated or also officially quarantined?
Well, this is where I've brought in the issue of routine. You know, so getting up in the morning, having a structured day, even if you are in quarantine and you are not working, you structure things to do. I've introduced people, and my one of my clients said, "Oh, well, I've started my album." Of course,
Nice. Hobby time.
don't you have a camera? We all have a camera these days. Even I will bring it out. Even before this thing, maybe as far back as 7, 8 years ago, one of my clients who loved photography developed agoraphobia. Agoraphobia is fear of open spaces,
Yes.
fear to get out of the house. So all I suggested was, and that was before good mobile phone cameras, but she had a very quality photography camera. So all I said was, get up in the morning, take a photograph of, stand in front of your house, take a photograph. Don't worry, just shoot uh, a few photos. So I really don't believe she would have got up before 10 o'clock in the morning. 12 o'clock, lunchtime, the same spot. And I'm challenging everyone on this line to do the same because you all have a camera. 3 o'clock, same spot, stand in front of your house, take cameras, just shoot. And then again, 6 o'clock or in the evening. Now, she was surprised. She was stunned by the quality of photographs that, in the end, guess who went a model for him or for her? It was Francis. And I still have some of those photographs. I went a model for her to take photographs of me.
Right.
So we have the tools there. So let's start doing things differently. Yes, you are in quarantine. If you structured your day, you will find lots of things to do. Put those photos together and share it with your friends. Of course, we've got this. I call it the evil and the good social media that you can share. Rename me. Go through your photo albums. I've got in my office my 10 years of photos from Facebook. And when my clients come to my office, I give it to them to have a look at it while they say, "Oh, you've been to all these places." Of course, I've been to all those places. And then have some stories to it. I'm sure you will never be bored.
That's for sure.
In quarantine.
So
have stories. Start writing. Kitinda has written how many books already?
Oh, just one.
Just one, okay.
One book. So just the beginning, I suppose.
Just the beginning. So start writing your story, and that may turn out to be a book. Okay. So we have knowledge there to share, and it's I said I wasn't going to use it this evening, but this question has brought it back to me, Kitinda. So I'm going to ask the question.
Sure.
Do you have anything made in Japan? Of course, we all have something made in Japan.
I like that question, Francis.
Our music.
I like that question because when you asked me, I had to really think hard because I wasn't sure which angle you were coming from. And I was thinking, what do we have made in Japan? And all I could think of was lipstick. And then I realized I drive a Japanese car too. And I guess I have now to think more. What else is Japanese that I have? And
yes,
it's interesting you asked that question.
Yes. So after Hiroshima, the Japanese said, we are not going to lie down and all of us dying. We want to revitalize our economy. So in terms of crisis, there are opportunities. And these are some of the opportunities that we have. We have time to rethink. We have time to restructure. We have time to put what is important for us. What is life? I've also seen the other side of things. Even last night, I was shocked and when I discovered one of my friends passed away in Ghana. You know, it's happening. But for those of us who are here, let's make the best out of it.
Right, right.
And we can find time in quarantine to do so much.
That's true. Now, I've got a question from Mary. Mary asks, how can I reduce the stress of working from home while my kids are also forced to stay at home from school?
Well, that's I've answered that a few times, and I will go back to the word routine and finding things for the kids to do, but also not just a routine, having a dialogue, having a conversation. How do we sit there in the morning? It's like, going to some offices, or for us nurses, before we take over the shift, we have to have a handover. So why don't you structure your day and have that, the rush which you used to do, run out of the house.
Yes, we all do
The
it.
kids having very quick breakfast, or hey, come on, let's go. The time, the traffic, all those sort of yelling about things which are so irrelevant. Why don't you sit together and have a planning of the day? Say, okay, Kitinda, Francis, what are your assignments for the day? What's your work? How long can you do it? In fact, as you know, no brain can even operate fully on 1 hour. So that's why we have breaks between subjects at school, breaks for morning tea, lunch. The same team sit together, plan the day. Okay, if one person is going to finish their assignment, just take the other person to go and do something else. What about cooking together? I keep bringing cooking, but yeah, it's something that we need. I could revert to the Maslow hierarchy of needs. Food, number one, shelter,
Yes.
water, all those sort of things. Isn't it nice to actually observing your children actually having lunch or eating lunch together, or actually having them to eat things that they don't normally want to eat? Do you know whether they eat their fruits that you put in their lunchbox,
That's a
or they
good
chuck
question.
it in the bin, or they chuck it in the bin?
Yeah.
So why don't you sit with them, draw up a plan, morning tea time? Okay, today we're going to have fruit. We prepare the fruit, we wash it together, we cut it, we share it, we make something from it. Tomorrow is when? Thursday morning, I'm going to visit one of my clients who makes me a nice Italian coffee. I wouldn't argue about whether it's Italian, Greek, or Turkish, but for me, I call it nice Italian coffee.
Right.
But she had a stroke at the age of 53. We've worked, yes, your face went. We've worked together the last 4 years under the NDIS, and she hates cooking. Guess what? She has actually made some scones, and her grandkids love it. So I have I'm going to have my special treat of scones. She's going to make it tomorrow so that I could come in and have real homemade scones on Thursday morning with my Italian coffee.
Wow.
And guess what?
So you're
I'm looking
forward
I'm
to it.
looking forward to it. So that's another thing we need to do, is to have something to look forward to. Like I said, even Friday night, fish and chips, why don't you experiment making your own fish and chips from home and get the kids to be involved? I made my own battered beer fish, and it was delicious.
Of course. Now, Francis,
Long answer, but it is important.
I was actually thinking something else people can do, like before we're talking about, the stories about food, but also having like a storytelling session as a family. Because, I believe, so many stories are passed on by people who are older, who've heard some stories. And we're talking, like, I know a lot of stories based on what my grandmother told me. And obviously, these are
Yeah.
stories she was told as a child as well. And I think in today's society, what we're forgetting is we don't share those beautiful stories of where we've come from, just with our families, even friends on the phone. People. I think it's a good time for people to take the time to get to know each other a bit better, even as a family. And I have this thing I like to do, and this is just something I want to just add on this. As a family or as friends or work colleagues, it doesn't matter. So, but mainly, I think as a family, especially in this time of COVID-19, I always do a 3-month checklist. It's almost like saying every 3 months we sit down as a family and we analyze what are some things that we don't like about each other. And this is something you have to really be open minded about, because how can you grow together and be stronger, healthier, and peaceful if you cannot accept your blind spots that other people see? So I get my son to tell me, he's 11, and I said to him, what is it you don't like about mom? And what is it you think mom can do to improve on that? So it's really a thing of helping each other just get stronger and grow and get to know each other deeper. Because I think we were so busy that we don't even know our children. They don't really know the parents. We just talk, and as you said, it's get out of the door. We are running to the school. You're doing everything's quick, 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 quick. Nobody takes a moment to pause and stop and say, let me just take it easy. Take one step at a time. We don't do that. So I think with this quarantine time, it's a good time for people to pause and start talking to each other, finding out how can we help each other grow from things we don't like about each other. I think that's very healthy. What do you think, coming from a mental health nurse?
Actually, that's a very, very, very important point. And this is what I use for the couple counseling. So in couple counseling, one of the assignments that I give is, what do you like about your partner? And the reverse is, what don't you like about your partner?
Right.
And then the other person will do the same. And then they will come back and discuss it. And you'll be surprised if sometimes they've been together for so long, they don't even know until somebody reminds them and starts waking up, really. And I usually start with what I call, I call the toothbrush coating. You see, when you meet the toothbrush coating, when you meet somebody, first time they come to your house, you put your toothbrush down, they don't touch it. As soon as they move in, you put your toothbrush down, they turn it the other way around.
That is so true, Francis. That is so true. Oh, God.
So that's the toothbrush thing. So that's how you get to know people. And yes, that's absolutely necessary. Now it's about time we start talking, having the conversation, having a dialogue. Before you get out of the house. Like I said, unfortunately, what is happening with COVID that we are not addressing and that not understanding is we don't know really how people are catching it. Despite all the theory which is out there, the other thing is there's a lot of false information out there. So it's about protecting ourselves, but it's about having that conversation with the children. We 100% know that the children are not getting as much as the older people. But what we are hearing is that the children can easily give it to the other people. So if you're not educating the children enough to be aware of it, then of course they're bringing it, they're infecting people.
Right.
And then it goes on and on and on.
Now I've got a question here from let me just see who's this one. Okay, so this is a question from, I'm trying to make sure I've got the right name here. Okay, so the question is coming from Tim, and he asked the question, what can I do if my spouse, a family member, or a close friend is experiencing anxiety about the COVID-19 virus?
Okay. So it's about support. What support do we provide for people? How do we understand what are they experiencing? Having the conversation. And as you know, as therapists, I actually did say that the first point of call is the GP. Of course, the GP. But we, mental health nurses, psychologists, psychiatrists, we get sometimes very, very little information from a GP. And a GP, they're busy. They will write, thank you for seeing Mrs. So and so, for even the diagnosis might not be there, seeing so and so for treatment or for assessment and treatment. So it's about getting to know somebody. So we start sometimes from scratch. We ask significant amount of questions. Sometimes people feel very intrusive that we're asking this question. Yeah. Where were you born? How many children? These are all very, very relevant things. Has the person experienced anxiety before? What was the trauma or what was the issue that caused that before? And a lot of the times, the person actually has a lot of the answers to the problem.
Of course.
It could have been they had witnessed something, car accident, some trauma, some assault, some violence that has caused them. Or for that matter, I'm working with a Chinese lady who used to work in China during the SARS. Now, she is super strict. And she said, Francis, you can't come in here without a mask. You can't come in here without sanitization. You can't come in here without the gloves on. Of course, she has actually been through it.
She's experienced it.
Yes. She's experienced it. But also she's protecting her clients in her house because she knows that if we don't do the right thing, everybody will be affected. So my suggestion for this particular case will be to listen to the person, find out from her or him what she's experiencing or he's experiencing, and then find what we call solution-focused therapy. I repeat, solution-focused therapy. By using the person's own experiences, we can find a solution to what the problem may be. Obviously, you are not a doctor, you're not a treating team. You are just there to provide support. At the end of the day, if it's beyond your means, then you suggest, why don't you go and see your doctor for actual diagnosis and then the treatment that will follow.
Now, I've got another question here from Charlie. And Charlie says, I'm worried about my underlying health condition that makes me more susceptible to the COVID-19 virus. How can I worry less?
Okay. So, in fact, the truth is, what is happening is that the most of the medical centers are actually saying that people are not seeking treatment or seeking follow up for their existing illnesses because of the fear of, I guess, catching COVID-19.
That's right.
If they go out. Like I said earlier on, we have the means of doing telehealth, doing with a GP or the practice nurse. So we're getting used to the technology. I've reactivated my Skype.
Yes.
I was using Skype forever, and
Right.
then the last few years I changed to Zoom. We have so I was sticking to Zoom, although now I've used so many webinars. I can't even remember the names of them. Some different health services using different ones, and they will insist they'll prefer theirs. I'll say fine, just send me the link. I'll download it. I'll use it. So I have been using multiple, telehealth equipments to see to my clients, and so you have access to your doctor. Get your checkup. Make sure your existing illness is under control. You don't need to go there for your script. The GP will send your script to the pharmacy. Your pharmacy can deliver. So don't put yourself at risk if you are in a health compromised situation.
Right.
Just ensure that you are following up with existing. Of course, unfortunately, certain illnesses cannot see their doctors, but so far as things are under control, that's the best solution for you.
Okay, now I've got a question from Acosta. He says, if I have mental health condition, what can I do to prevent COVID-19 anxiety from making it worse?
Well, obviously, with that, you have a diagnosis, you possibly on treatment, and treatment is not just medication. So it's again follow up, having contact with your clinicians, whether it's a case manager, a psychologist, a psychiatrist. The important thing is to following up your current treatment plan. I've noticed I've been having a number of my old clients who I haven't seen for a number of years, but they're contacting me. Some of them we've just had a chat on the phone and giving them some reassurances, giving them some strategies, and they haven't come back. Others have made appointments, either I've seen them face to face or through telehealth. So make contact with your treating team and then follow up with that treatment plan. If you haven't seen a treating person for a long time, re-engage with those people and ensure that you are following some form of support. And as I'm saying, it's very, very important at this time, having some support person or having somebody you can call and just having a chat about how you're feeling. And sometimes it's not being flippant, but sometimes it's a common sense type approach. Very, very, but of course, when you are in that situation, you cannot think about those things. It's your therapist who can think about those little common sense things that will assist you.
Right. Now we've got one more question from Samir. Samir asks the question, what do I do if I'm worried about racial profiling because of the COVID-19 virus?
Well, I'll tell you my funniest one, and Katinda knows. maybe I can't find my any hats close to me here, but as you can see, I'm dressed up in my African clothes. I have my African or Ghanaian made mask. My mask arrived here, I think, on the 9th of April. So it was way before everybody. And I was so disappointed because I was dressed up in my African clothes. I went to the Shire of Mitchell, which is in part of the lockdown area, which is really the semi-country area. I had my funny mask on and nobody looked at me. Oh, how bad that was. So don't feel necessarily bad about people saying that people are being racially profiled. This morning I heard, and first it sounded, ooh, that was a little bit tough to say that in the Asians, well, in Hong Kong, how the person said was in Hong Kong, during the SARS, everybody was wearing masks, or
Right.
in China, people wear masks. I've been on holidays to Japan, and you see people wear masks when there was nothing even before COVID.
That's true.
Now, unfortunately, one of the complacency that happened here was people felt if they were wearing masks here, they will be singled out. So one of the community that probably also failed to wear masks in big numbers were the Chinese or the Asians in those areas of Box Hill or Chinatown and things where they could have assisted in raising the profile of wearing masks. So their failure there also failed to support the general feeling of people needing to wear masks. Now, of course, the African community, has been blamed partially uh, for what happened in the high-rise flats. Well, it's not just being blamed in that or being racially profiled, but it was a systemic failure for the whole system, that people were not educated enough. And so it's about education. How do we educate our neighbors? If the person was on, when I said it earlier on, I went to a shop. People were not wearing masks. I turned into a COVID police officer and said, people must wear masks and people should not come to the shop. Are you brave enough to check on your neighbor or ask your neighbor to put on their mask before they get into the shop?
Right.
Are you brave enough? Are you brave enough to actually social distance? I stood back in the queue when people were crowding the front. No, I wouldn't. I have the time. I stood back until the crowd left before I went closer to the counter. I made sure before I got into the shop, I used my sanitizer. In fact, I carry my own. I carry a spare mask in my pocket. I have plastic gloves that I wear. So if you are doing the right thing and somebody else is not, call it out.
That's
It's
right.
not racist. Call it out. And you and me will be protected. Unfortunately, what is happening is, people are cramping into the lift. Now, they said how many people can go into the lift.
I
We
think there's,
don't read.
I
We
think that,
don't read.
yeah, there's a policy. I think it's 2 people per lift. I think, depending with the
Yes,
place, depending where you are and how big the lift
of
is.
course. I'm using that one of the examples. People will just rush in and they don't think about it. So it's difficult not to feel that, well, this is being a particular group is being targeted. Unfortunately, the issue is they say we are all in it together.
That's right. Now,
So if you don't, sorry.
now, you know, that in that point there about the masks and racial profiling, but there's also the thing of if I've tested positive, people that know I've tested positive tend to discriminate against me because now they fear it could even be a family member, it could be anyone. So what's your take with that? Again, we're talking about educating people on the fact that you don't have to treat people like an outsider or like something else just because they've been tested positive, because this is something that can happen to anybody. Nobody is immune to this. It doesn't matter where you live, how much money you've got, what job you got, what's your label title. Anybody can get it. This is a situation which any human being can have it. So what is it that, how do we need to educate people? I know you've talked about the ratio thing, but if someone has been tested positive, how should people behave towards that person?
Well, when did you last hear anything about HIV or AIDS?
Well, since the COVID-19, we don't hear any more about it.
There's the seriousness of it, of this question is, again, in the late 80s, early 90s, this was the fear. I'm not sure whether you were here or how young you were when we had this film called The Grim Reaper in Australia,
No.
where I guess if you remember the Michael Jackson's film,
What, Thriller?
which one with the ghost, the trailer,
Thriller.
Yes. So something on the verge of the trailer film, and they use what do you call it? Ball. Oh God. They use a ball to hit these people, killing them as a means of frightening people. Well, that was very, very dramatic in terms of things.
Right.
So you couldn't really go near, or anybody that had HIV was almost like somebody who had leprosy, and therefore being shunned. The issue is, of course, we even don't know the effects of. Sadly, people have been tested positive, tested negative, and gone back to be positive again. So we can't rule out that people are not going to, be infectious once they have. But for God's sake, we are humans,
Right.
and therefore we need to treat people with respect and with dignity. It doesn't matter, how, so far as we are taking the necessary precautions. So anything that becomes out of the norm, we start um, stigmatizing those people, and sadly, we will have people who will feel that they're being stigmatized because they have the virus, or for that matter, they've recovered even from the virus.
Wow.
Charity begins at home. So if we treat those people with respect within our own home, within our own community, then we have nothing to fear. I'm very optimistic that this virus is going to disappear. I don't have a prediction as to when, but it will.
Yes.
And our so-called lives will go back to normal. I don't know if a lot of you remember, it was 1999 turning into the year 2000.
Oh, yes.
And again,
I remember
I don't
that.
know where you were, but billions of money was spent around the world. We end up with new computers, more computers at work than we had ever thought about. I was working at the Austin Hospital at midnight. I was on the phone and this was before the real days of mobile phone. But
Right.
I was on a landline phone. I was standing next to a computer, people shouting, "Turn off the computers!
Off.
Get off the phones!"
Yeah.
We had fire brigades, fire engines, we had police, we had ambulances,
That was
we had
crazy.
extra staff on. It was the disaster plan in action,
Right, right. Something that
and
never happened. Nothing happened.
it fizzed out. There was nothing, nothing, zero happened, and we lived ever after.
Well, that's 20 years ago.
September, yes,
Yeah.
September 11th, I was in Africa. I was flying back to Australia the following day. Of course, flying changed, but it's gone. The SARS came and went.
Swine flu.
The GFC, yes, swine flu. The GFC came and went. I will leave you with this last note. Of course, a lot of us have never experienced active war, but this is where we are. We are in a war zone. We don't know all the things that we've talked about, all the fears, all the stress, the anxieties. It's as though we don't know where the next food is coming from. We don't
That's
know
true.
when the next bomb is going to drop. We don't know when the militia are going to come. For some people, they have experienced the real war. We are being given just a taste of it. But we must be. We are humans. We have to be resilient. We have to think about ourselves. But more importantly, we have to care about each other.
That's
That's the
right.
most important. It's about thinking about each other, checking on our neighbors, checking on our friends, suggesting things to people to think about. Sometimes when you are in a frightening situation, you can't even think about, oh, should I get out of bed to go to the bathroom, or should I pee the bed?
True.
So very important that we start taking care of ourselves and taking care of each other.
Now, Francis,
Thank you.
before we conclude, I know there are so many ways to protect our emotional well being, our spiritual well being, and physical well being. What are three things people can do right now to start their self care journey and to protect their health, mental well being?
Well, I will start with ensuring that you eat well, you drink well. When I mean drink, I mean
Water,
water and
tea.
fluids,
Mhm.
tea. In fact, I'm even when I'm going in the car, I put an herbal tea in the cup and take it with me. I have bottles of water in the car. Um, but the most important is ensuring we get some exercise and a good night's sleep.
Yeah.
I always say, for me, do you know what your minimum hours of sleep is, Kitinda?
Well, for my type, I can only do 6.5, 7 hours at the most. I can't sleep more than that.
Okay. So for me, the minimum is 7 hours. Now, it can be Mr. Grumpy if he doesn't get his 7 hours.
Right.
So again, it's about us judging for ourselves what our minimum hours of sleep is. Pardon me, and ensuring that we get our minimum hours of sleep. Without that, your body, your thinking, your actions, your productivity will all fail. So get your good night's sleep. Don't spend. I have been teaching people, especially the young ones who had to give up going to work, school, etc. I have clients who were sleeping until 12 o'clock, 2 o'clock in the afternoon, and I had to get them to back into that so so important routine.
Sure.
Getting up the same time in the morning and going to bed at the same time each night, ensuring you have that good sleep, then taking your fluids and eating properly. I mean, eating properly. I talked about having breakfast, lunch, morning tea. It's not the fact of having snacks all day and then dinner, you're not eating anything. You need to have a proper meal at the right time and getting your good night's sleep.
Now, Francis, this is a question for you. So our viewers probably, you've given us some very beautiful advice, all the strategies, the tools for our toolboxes. But this is a question for you. So what are you doing for yourself as a busy mental health nurse to care for yourself as well as have a work-life balance?
This is so busy that, as I mentioned, I guess one of the things I enjoy doing is cooking. I'm supposed to cook more than but of course the Sunday cooking is there, and we go to the markets every second weekend. We go to Victoria markets all the way in the city, so that's a drive. I'm busy, so I get in and out of the car, the fresh air, getting my vitamin D, as I call it.
Right.
I also occasionally take the vitamin D tablet. I take my vitamin tablets. Um, I'm missing my holidays, of course, but I also have other social involvement, such as being in Rotary.
Right.
Rotary is a voluntary organization that we do things. I just was talking to my brother in Ghana. At one stage, I organized a container load of equipment to Ghana. Now, I started this process maybe 8 years ago, and at my last count, probably because of this initiative, we've had more than 22, I'm guessing between 20 to 50 container load of equipment to Africa, only because Francis started this process. And as they say, it went viral, and the rest is history.
Well done. Well done.
The number of people that I have brought into the Rotary family, it's unbelievable. Both, locally in Australia and overseas, not just in Ghana, but in other parts of the world, the US. My classmates, what's all this Rotary thing about, Francis? And they've ended up joining Rotary. So yes, I do a whole lot of things, but I keep my mind busy with a number of activities.
Right, Francis, as we conclude now, this is just the last thing. What is one thing you can tell the viewers that are watching? And if you're watching, please, if you have any questions, please make sure you send those questions to us, because we can always have these questions answered in another session like this one. So what is the one thing that the viewers watching today must do to overcome the anxiety, if they have any, during this COVID-19? What's a must do? Something that they have to do every day. You've talked about a lot of things: routines, eating healthy, exercising, sleeping well. But what is just the one thing? Because, a lot of these things it's very hard for people to get into a new routine, because it's somehow, once you've been into bad habits or certain habits, you can't just change it. So what is one thing which is not difficult to do that they can actually implement right now after this conversation?
Well, as I said earlier on, I didn't want to use the word mindful. But the other day, and this is an unusual year where we all start to get to know somebody who has passed away, or heard of somebody who's passed away. How do we recognize that? How do we come to terms with that? I though we think about, first of all, religion. I have Muslim friends, and I know in the Muslim religion, they've got to be buried within 24 hours.
Right.
In the Jewish religion, they've got to be buried within 24 hours. In other religions, within days. In other cultures, different. We all do those sort of things. So in my thoughts, we all have, whether you don't believe in anything at all, we all have a way of recognizing the dead. So what I will suggest is, however, whatever you may call it, a prayer, a salute, when you get up in the morning, spend 5 minutes to think about being alive again. Being alive. And you can thank whoever you want to thank for being alive. Because we don't know. I've come across people who have disappeared. And then yet they said they found them dead in their sleep. In fact, this famous musician, a couple of days ago, from the Fleetwood Mac person, dying at the age of 73.
Who's that?
I can't remember his name, but he was in the group before the Beatles called Fleetwood Mac.
Right. That's a long time ago.
He died only last week, or the last 3 days.
Right.
And he died in his sleep, or didn't wake up.
Right.
So let's thank whoever, even if we wish to thank ourselves for waking up in the morning or whatever time we do wake up. So I'll leave you to ponder on that thought of being alive.
It's interesting you say that, because that's one of the things I do. I have this journal, a gratitude journal, which every day I write 3 things in the morning when I wake up, 3 things I'm grateful for, and 3 things I'm looking forward to the day. And at the night before I go to sleep, I do the same thing. What are 3 things I was grateful for that happened in the day, or things that I look forward to, whether they did happen or not? And I find always saying I'm grateful for being alive. As you said, it doesn't matter what God or what people believe, but the source energy, divine energy, higher power, whatever that is for anybody. It's very important, because I find that grounds you, and it starts your day and finishes your day very well. Because when you're grateful, you cannot be worried at the same time. You cannot feel hatred. You cannot feel jealousy. You cannot feel not at peace. Because when you're grateful, and you're going to be grateful with a pure heart, not grateful because you're just saying, I'm grateful for this. You're going to pay attention to it, pause, slow down, say it, and mean it, because it's important to connect with source in that moment as well. So that's, for me, is a powerful tool, which I hope the listeners can take that on board and just do your gratitude every morning when you wake up. Because as Francis said, we're not guaranteed to be here the next day. We don't even know what tomorrow has for us. Yep. We have only the present moment, which is right now. So if you can learn the art of gratitude, that is something which will enhance your life, will make you feel more inspired. You can inspire the people, because there's a lot of negativity in the world. And I believe when you're grateful, you cannot be negative. Yeah. So that's all for today. Thank you so much, Francis, for your insight and sharing those amazing tools for our toolboxes that we can use to protect our mental health and emotional well-being. And thank you, viewers, for being fabulous and watching the CWK show, Conversations with Katinda. And that's it, folks. Good night.
Good night.